You're welcome to Health with Mariam, and we'll be talking about strokes under the following headings. What is a stroke? Types of stroke, most common and most deadly types of stroke. Which gender is stroke most common in? What does a stroke feel like? And I'll be answering the most popular questions on stroke. So let's get into it. So, what is a stroke? A stroke occurs when the blood flow to a part of the brain is interrupted or reduced, depriving brain tissue of essential oxygen and nutrients. This interruption in blood flow can occur due to a blockage in an artery or the rupture of a blood vessel. What are the types of stroke? There are two primary types of stroke: ischemic stroke and hemorrhagic stroke. Ischemic stroke is a type of stroke which occurs when a blood clot buildup blocks an artery, impeding blood flow to the brain. Hemorrhagic strokes result from the rupture of a weakened blood vessel, causing bleeding into the brain or the spaces surrounding the brain. What is the most common and most deadly type of stroke? Ischemic strokes are the most prevalent type, primarily due to factors such as hypertension, high cholesterol, and diabetes, which contributes to the formation of blood clots or plaque buildup in the arteries. However, hemorrhagic strokes, although less common, are often more deadly, as the bleeding can lead to increased pressure within the skull, causing widespread damage to the brain tissue. Which gender is stroke most common in? Stroke does not discriminate based on gender, but there are some notable differences in prevalence and risk factors between men and women. Historically, men have had a higher incidence of stroke at younger ages, largely due to lifestyle factors such as smoking and alcohol consumption. However, women tend to have a higher lifetime risk of stroke because they live longer and are more likely to experience risk factors such as atrial fibrillation and migraine with aura. Additionally, certain conditions such as pregnancy and the use of oral contraceptives can increase a woman's risk of stroke. So, what does stroke feel like? The experience of a stroke can vary widely depending on its severity and the area of the brain affected. Common symptoms include sudden weakness or numbness, typically on one side of the body, difficulty speaking or understanding speech, confusion, dizziness or loss of balance, severe headache, often described as the worst headache of someone's life, blurred or double vision, difficulty walking or coordinating movements. And now, I'll be answering some popular questions on stroke. Why do strokes occur in the bathroom? Strokes can occur in any location, including the bathroom. However, there are a few reasons why strokes may seem more common in the bathroom. They include sudden changes in blood pressure. The combination of hot water, steam, and sudden changes in body position, such as standing up quickly, can lead to fluctuations in blood pressure, which may increase the risk of stroke, particularly in individuals with pre-existing hypertension. Increased risk of falls. Bathrooms can be slippery environments, especially around wet surfaces like shower floors or tubes. Falls in the bathroom can result in head injuries or trauma that may lead to strokes, particularly if there is bleeding in or around the brain. Use of medications. Some individuals may take medications or engage in behaviors such as drinking alcohol before or during bathing, which could increase the risk of stroke. Question 2. Why do some people have strokes without knowing? Some strokes are known as silent strokes or asymptomatic strokes, and they may occur without noticeable symptoms. These strokes often result from small blood vessel blockages or bleeds in the brain that cause minimal or no immediate damage. While individuals may not experience classic stroke symptoms such as weakness or speech difficulties, these silent strokes can still lead to long-term cognitive impairments such as memory loss or difficulty with thinking and reasoning. Question 3. Why do stroke patients cry? Emotional changes, including sudden bursts of crying or uncontrollable emotions, are common among stroke patients and may be attributed to several factors, which include brain damage. Strokes can affect areas of the brain involved in emotional regulation, leading to changes in mood, behavior, and expression of emotions. Loss and frustration. Stroke survivors may experience feelings of loss, grief, frustration, or anger due to changes in physical abilities, independence, or quality of life following the stroke. Depression and anxiety. Stroke survivors are at increased risk of developing depression and anxiety, which can manifest as tearfulness, irritability, or emotional liability. This is why stroke patients cry. Question 4. Why can stroke patients not sleep at night? Sleep disturbances, including difficulty falling asleep or staying asleep, are common among stroke patients and may be influenced by various factors, which include pain and discomfort. Physical discomfort such as muscle stiffness, pain, or sensory changes can make it challenging for stroke patients to find a comfortable sleeping position. Medications. Some medications prescribed for stroke-related conditions such as pain relievers or antidepressants may affect sleep patterns or cause drowsiness during the day and insomnia at night. Psychological factors. Anxiety, depression, or post-traumatic stress related to the stroke experience can disrupt sleep and contribute to insomnia. Changes in brain chemistry. Brain injury resulting from stroke may disrupt normal sleep-wake cycles and circadian rhythms, leading to sleep disturbances. And last but not least, question 5. Is there any food that can cause stroke? While there isn't a single food that directly causes stroke, certain dietary patterns and food choices can contribute to stroke risk factors such as high blood pressure, high cholesterol, diabetes, and obesity. Foods that are high in saturated fats, trans fats, cholesterol, sodium, and added sugars, as well as processed and fried foods, when taken excessively, are generally considered less healthy and may increase the risk of cardiovascular disease, including stroke. Conversely, a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats can help reduce stroke risk by promoting heart health and maintaining optimal blood pressure and cholesterol levels. And I'll be stopping here for today. If you'd like to dig deeper into strokes, I'll be posting another video where I dig deeper into strokes, what happens when strokes occur, and how to diagnose strokes. If you're interested in learning all about that, watch out for the video or check my page to see if I've already posted the video. Thanks for watching. Let's all be stroke conscious, and goodbye. Don't forget to like, subscribe, comment, and that's all for today.